Non-Hodgkin lymphoma. Non-Hodgkin lymphoma, NHL, is a proliferation of lymphocytes in the lymph nodes and spleen. NHL is most often widespread at presentation and can affect any lymph node or organ that has lymphoid tissue. NHL and calais are extremely similar, but NHL is a solid mass and calais is liquid or circulating. In non-Hodgkin lymphoma, the affected lymphocytes start to multiply in an abnormal way and begin to collect in certain parts of the lymphatic system, such as the lymph nodes, glands. The affected lymphocytes lose their infection-fighting properties, making you more vulnerable to infection. Presentation. Painless lymphadenopathy may involve pelvic, retroperitoneal, or mesenteric structures nodes not warm, red, or tender. B. Symptoms. Fever, weight loss, drenching night sweats. We will differentiate infection from NHL. Infection gives warm, red, and tender nodes. Diagnostic tests. The best initial test is an excisional biopsy. The CBC is normal in most cases. High LDH levels correlate with worse severity. Staging determines the intensity of therapy. Staging NHL does not often change treatment because in most cases, disease is widespread, stage 3 and IV. Typical staging procedures are CT scan of the chest, abdomen, and pelvis bone marrow biopsy. The most common mistake is to do a needle aspiration of the lymph node. Aspiration is not enough, because the individual lymphocytes appear normal. Staging. Stage 1, 1 lymph node group. Stage 2, 2 or more lymph node groups on the same side of the diaphragm. Stage 3, both sides of the diaphragm. Stage 4, widespread disease. Treatment. Local disease, stage IA and IA. Local radiation and small dose, course of chemotherapy. Advanced disease, stage 3 and IV, any. B. Symptoms. Combination chemotherapy with CHOP and rituximab, an antibody against CD20. C equals cyclophosphamide. H equals adriamycin, doxorubicin or hydroxydownrubicin. O equals vincristine, oncovan. P equals prednisone. NHL presents in advanced stages in 80% to 90% of cases. The overall 5-year relative survival rate for people with NHL is 74%. But it's important to keep in mind that survival rates can vary widely for different types and stages of lymphoma.